Pancreatic cancer is one of the deadliest malignancies. A lot of the time, it's not diagnosed until after it's metastasized, and survival at 1 year following diagnosis is only around 10%. So when trial results were announced at a conference in late May 2026, showing that a daily pill could almost double patient survival time, the news got a huge standing ovation. The global Phase 3 RASolute 302 trial, led by Dr. Brian Walpin, an oncologist at Dana-Farber and Harvard Medical School, compared the investigational drug daraxonrasib with intravenous chemotherapy in patients with previously treated metastatic pancreatic cancer. Median overall survival was 13.2 months with daraxonrasib versus 6.7 months with chemotherapy. So why is this drug showing such exciting results? Well, a lot of cancers, including over 90% of pancreatic cancers, are driven by mutations in a gene called KRAS, which is part of the RAS gene family. You can think of RAS proteins like molecular switches. When they're on, they send proliferation signals that push cells to grow and divide. When they're off, these signals go quiet. Earlier RAS targeting drugs generally work by binding exposed pockets on RAS that are accessible when it's in the off state, which basically traps RAS in its inactive form. This strategy can be powerful, but a lot of cancers have mutations that force RAS to stay in the active state, which makes these drugs less effective. For these cancers, we need to target RAS in the on state. But this is tricky because active RAS is a very smooth protein and doesn't really have convenient binding pockets. Daraxonrasib, though, is designed to target active RAS, but it doesn't rely on binding RAS alone. Instead, it binds first to an intracellular protein called cyclophilin A. This complex then binds to active RAS to form a tricomplex that blocks downstream signaling and effectively makes RAS inactive. This mechanism works for several types of cancer-causing RAS mutations that lock RAS in the on state. And what's more, daraxonrasib works on multiple members of the RAS family, not just KRAS. Daraxonrasib is still investigational, but the FDA has allowed expanded access, and trials are already evaluating how it could be used in other cancers and potentially combined with different treatment approaches. If you want to understand how mutations like those in the RAS gene family can cause cancer and how they can be targeted for treatment, check out our HMX course on cancer genomics and precision oncology.